My name is Dr. Joyce Javier. I'm a pediatrician, scientist, and mother of 2 daughters. My work, called the Filipino Family Health Initiative, would not be possible without our multidisciplinary team. We have academic, community pediatricians, occupational therapists, psychologists, parents, grandparents, and multiple community organizations such as churches and schools and CBOs. As my colleague, Dr. Kevin Nadal, recently said, when someone has the support of their community, they can achieve anything. And I really feel that here at FWN, so thank you, Marilee Mondahar, for creating this community. So we're going to be talking about the Filipino Family Health Initiative Global Pilot Study, which was my global pitch project. Next slide. So let's start, oh, is it PDF? Maybe you have to just scroll down. Yes. Maybe this way. I think he just has to go here. Okay. So let's start with the why behind my global pitch project compared to other ethnic subgroups. But we know that evidence-based parenting interventions in childhood have proven to be effective in preventing these child mental health disorders. FFHI has provided such programs, and in these programs in California, they originally were in person, and then with the pandemic, a silver lining is that we moved it online. And we were able to show that after parents did 12 weeks of a parenting program online, their children reported less depression and anxiety. And so our goal for this global pitch was to see if this can work outside of California. And so we wanted to offer this same parenting program online to other states in the United States, as well as the Philippines for the very first time. Next slide. So in order to test something in science, basically we recruited families, and we had to have them do a survey, and then we had to flip a coin and say that you can do the program right away, or you have to wait 3 months to do it. And so we did that in a small pilot, and we were able to get 12 parents to participate. And in our groups, we would have people from Ilocos, Cebu, Quezon City, Texas, and California, all in one group. And I know this is a very busy slide, but it just kind of goes over, how many parents, went into the session. So about, ranging from 7,700 to 100% retention. We had about 4 in the Philippines in the first group, and then 1 in the Philippines, so it kind of went up and down. We definitely had more females than males who participated. Next slide. From this, we had several lessons learned. Since the Incredible Years program is actually has videos as part of it, these videos are not yet translated into Tagalog, unfortunately, but that's on my list of things to do. So we had to unfortunately exclude participants that were not able to speak English fluently. We also recruited through social media, mostly through Facebook. And we also learned, how do we retain these families in the study? We learned that email culture wasn't so strong in the Philippines with the parents that we had. So we had better retention when we used Facebook Messenger. And also Google Calendar, because these busy mothers were trying to integrate the events in their lives into their online calendars. We also found that many Western concepts of parenting are still new to the parents in the Philippines, but there was a lot of evidence of intake. For instance, one of the mothers who participated, she started the study and the program while she was living in the Philippines, but she was preparing to come to the US to become a teacher here. And so I just was in awe of her, because she would spend 12 weeks with us while she was getting ready to leave her kids behind. So she really, really was a champion of the program. We were also fortunate to have Dr. Caitlin Legaspi, who actually gave a talk for the Global Pitch online a few months ago. And she is a UP grad who's currently applying for a pediatric residency in the United States. And she co-led and translated for me and provided a lot of culturally appropriate context. So very grateful for her. We also had to deal with the challenges of having a different country's healthcare system. Next slide, 5 minutes, yes, next slide. So we had to make sure, because we actually ask about suicide in the program, in the surveys, we needed to make sure we can act if needed. So we looked up the different resources, and I'm very impressed with the resources by region that the Philippines has. Next slide. So these are just some examples of testimonials from the families. It's hard to accept losing to your kids as Filipinos. We grew up with elders always being right and that good children do not talk back. But how will they learn to fight for themselves if we don't teach them? Next slide. And there's another feedback about how we need to express our feelings so that our children can learn to express them. They'll watch it through modeling. Next slide. So, so what are we going to be doing next? So basically, we're very grateful for the funding that we've gotten from Marilee, but also Dr. Bem Kuliat and other grants. These are just our trainees who've been benefiting from volunteering with our program. Other things that we're working on is publishing this data and applying for more grants, and also Dr. Avril Sepulveda, who is my partner in crime who led these groups. Both of us were recently nominated for a program called ALTA, which is a human atlas of the City of Angels by a photographer. So in partnership with the Getty Museum, we were chosen as 100 individuals making positive change in LA County, along with Dolores Huerta and the late Reverend James Lawson, who was an advocate with Martin Luther King Jr. So it was really nice to have that honor, because there were only 5 other Filipinos there, and it was very humbling to have that. So it's going to be shown in the Downtown Central Library. There's a podcast, and there's an interactive book about it. Also, there's no research. No research means no resources. So I'm very pleased to say that after trying 5 times to apply for a grant over 6 years, the Filipino Family Health Initiative was awarded $4.17 million from the National Institute of Health, Minority Health and Health Disparities. So next slide. So that is my ask. This is the study that we're doing now. I'll pass around the flyers. It's in California. If we don't show the government that our Filipinos are participating, they're not going to give us funding. So if you know a Filipino parent ages 8 to 12 in California and they're interested in an online program, we will pay them $325 to participate in this workshop. We also are doing a dementia registry, which is US-wide, to make sure Filipinos are represented in dementia research. We keep talking about dementia and Alzheimer's research, and to help our caregivers taking care of our families. This is a $10 gift card, and if you're 50 and above, you can do it, or if you're 18 and above, if you're a caregiver. So please register for the dementia registry. All right, one last thing, sorry. I recently co-authored a publication on a special supplement on racism in pediatrics, and it came out this month during Filipino American History Month. Because our children, right, they don't vote, and so we need to stick up for them, right? So that was a very humbling thing that just got published this month. Thank you for your attention.